Hi, everyone. My name is Sammy Boomgard, and I'm the Mental Health Promotion Coordinator over at the Health Education Resource Center. This week, as a part of the Semicolon project, I'm going to chat with you all a little bit about suicide intervention and what you can do if you're really worried about a friend or a family member. There are times in life when those we love and care about go through tough times. And, sometimes it's easier to spot. Maybe they're withdrawing from you and others isolating themselves. You may notice dramatic mood changes, or they may be talking about death, dying more often than usual, or even talk about killing themselves. Other times it may be harder to spot, and it may show up as rage, anger, anxiety, maybe feeling trapped or hopeless, or even something like changes in sleep patterns. Or it may not even be anything on this list, but some kind of change in your friend or family member's typical behavior may be a sign that they're struggling with something. So what can you do if you notice these changes in a friend or a loved one? Talk to them. Ask how they're doing. And listen to their story. It is amazing the difference an empathetic ear can make to someone who's going through a tough time. If you're worried or you think that they might be contemplating suicide or harming themselves, ask them directly. There's this myth that by asking someone about suicide or harm, you're putting that thought into their head, but that simply isn't true. In fact, you're actually showing that you are confident and caring in the face of something that can be a pretty scary thought to keep all to yourself. So what if they do say that they're thinking of killing themselves? First, take a breath. It's okay to take a second to process. Tell them that you care about them and that you want to help. Clearly state that thoughts of suicide are often associated with a treatable mental disorder, because this may instill hope. Also, tell them that thoughts of suicide are common. They don't have to be acted upon, though. Stay with them and encourage them to think about things that have helped in the past. Doctors, therapists, friends, family members, other mental health workers, or even a community group that has provided support. And finally, encourage them to seek professional help. EIU's counseling clinic can be reached at 217-581-3413 during office hours, or call the 24-hour helpline at 1-866-567-2400. And never, ever hesitate to reach out for help if you or someone you love is thinking about suicide or just needs someone to process the difficult times that we go through.